Hey, turning 65 can be very confusing, especially in today's times. All of us are being hit by a lot of information. You're being communicated to maybe by your HR, by Social Security, maybe by a licensed agent, and you're gonna still confused. I'm gonna walk you through exactly how to not choose the one wrong date that can cause lifetime of penalty for your Part B and Part D. We're also gonna be covering about how HSAs work, and then what is the HRA and how does that pay out as well. And then I'm gonna end with a one sentence statement that you can actually take to the Social Security or call it Medicare and always know that you're going to get the exact date of starting your Medicare Part A or Part B or both or one or the other, depending on your situation and your employer size, or if you're just retiring and going on Medicare. Stick around, I'll be back in just a second. So let's talk about your initial enrollment period. Most of the time, people that are enrolling into Medicare are always kind of confused. And I like to use this, what I call 7-month window, to explain out of the 7-month window, what is the most crucial timing in when you're going onto Medicare, or if you're waiting and working until you're 67 and then qualifying because your full retirement age is 67 years of age for your Social Security. Then you're like, hey, I'm gonna wait till then, I'm gonna work till then, and then I'm gonna come off and draw my full Social Security retirement. Or I've got my father-in-law, he's actually getting ready to retire this upcoming August. He'll be turning 70. So the rules for him, he's on TRICARE, so he had to go on Medicare Part A and Part B. He doesn't take his employer coverage. He's on TRICARE, and we actually put him on a Medicare Advantage plan or an MA plan only that buys almost all of his Part B premium down. So and he didn't mess that up. Luckily, he did get that right. My father-in-law didn't reach out to me. He and I, we see each other all the time when he was enrolling into Medicare, but he was told the right thing. Luckily, if he had not been told the right thing and waited till he's 70, and then he's like, hey, Kelby, I'm going to retire and enroll into Medicare, he would have 5 years of Part B penalties. He's got credible coverage with his medication with TRICARE for life, but Part B starts at 65 years of age. So how do you eliminate this with this 7-month window that we call the initial election period? Well, just remember this rule, and this applies to any penalties. Always start 3 months prior of when you're 65, talking to a licensed professional like us and just asking like, hey, this is my scenario. I'm just curious on what my options are. And we're gonna ask the right questions to determine if you need to stay on your employer plan, if you need to enroll into Medicare Part A, or if you need to enroll into Medicare Part A and Part B, like my father-in-law, because he's on TRICARE, and TRICARE looks and says, hey, first payer position has to be Medicare, we're second payer position at 65 and beyond. So your situation depends on where you work, the employer size, HSAs, and so much more. We're going to dive into that in just a few seconds to give you some ground rules on how all that works, and then it allows you to be able to have a better understanding of what your options are enrolling into Medicare. So one of the other big factors and key points of Medicare that you need to remember is if you've worked 40 quarters or 10 years or longer, you qualify for Medicare Part A. It's an entitlement. You've worked and paid in enough FICA taxes, Social Security and Medicare. We have videos breaking down exactly how that works. We'll have that actually in the description. You can actually watch that video. It's very explanatory on exactly how Social Security and Medicare work together and how they're actually separate. So I would encourage you to watch that. Part A is a entitlement benefit. So if you've worked enough, you qualify for it, or if your spouse or an ex-spouse, based on some rules and regulations, have worked and paid in 10 years or 40 quarters, you're going to be able to draw off of their Social Security for Part A as well. So as an example, and I give this a lot, my wife has paid in almost enough quarters to qualify for Medicare off her own taxes, FICA taxes. But if something were to happen to me and she was 65 years of age, she actually would draw off of my Social Security that I paid into to qualify for Social Security and Medicare both. So that's important to know. If you are going on to Medicare, you can enroll into Medicare Part A. Now with that, an HSA, if you plan on continuing to contribute to your employer's HSA, you're going to work past the age of 65 and stay on your employer plan, you can't enroll into either part of Part A or Part B of Medicare. If you do, there can be a penalty assessed to your contribution into the HSA. So that's very important. 6 months prior to you going on to Medicare Part A, if you're going to be on an employer plan, or like my father-in-law, Part A and Part B went into effect. He didn't have an HSA he was paying into, but had he been paying into one, he would have stopped that 6 months prior. That's what the federal government's going to look at, is 6 months prior. Then Other than that, those contributions can be penalized. Sometimes it's not caught and done, but if you pay into an HSA for 3 or 4 years and then retire and the government gets wind of that and then penalizes you, it could be several hundreds of dollars that you pay in penalties. Now we're going to dive into the explanation of how an HSA and everything actually works. So let's remember, initial enrollment period, you can always start 3 months prior to turning 65, or when you get ready to retire and come off your employer plan, you're going to start, again, 3 months or 6 months before that process starts, because you're going to have to do paperwork and get with the Social Security office and apply for Medicare Part A and Part B online, or actually go down and sit in front of them, or do it over the phone. So we have a video and some videos out there to educate you through that process. If you need some help, you can call and schedule a time. We'll walk you through, handhold you. We have a guidebook. We handhold many hundreds of people each year through the process of enrolling into Medicare, whether you're 65 or you're working and beyond. So that's key. 3 months or 6 months before the early bird gets the worm. Don't wait to the last month before, because the process may take 6 weeks. They will backdate your Part A and Part B effective dates, but it's a lot less headache and a lot more problems when you wait to the last minute to do something. Thus, don't procrastinate. So the HSA fits in 6 months prior if you're going to start Part A or Part B or Part D coverage on your 65th birthday, or at any point after your 65th birthday that you're eligible to come off employer coverage. You would stop contributing to the HSA 6 months prior. Very important to remember that, 6 months prior. Then, where does an HRA fit in? HRA is an employer-funded account you don't own. So the HSA is something the employee owns and funds into. The HRA fits in because the employer funds the account. After you're on Medicare, or retirees, HRA or ICRA can be reimbursed for premiums for Part B, Part D, and MA and out-of-pocket costs if the plan allows. You cannot convert an HSA to an HRA, and a general purpose of the HRA usually disqualifies you from making new HSA contributions. Only limited purposes for like dental vision HRAs can pair with ongoing HSA contributions. So I say all of that to say this: you need to make sure you're talking to the HR, human resource manager that's working for your company, and making sure they're getting you connected with the group benefits person that set up your plan, to make sure if you have an HSA or they have an HRA, how they can work together if they can. There's rules and regulations, and every employer does it differently. For somebody just to make a blanket statement and say yours works like this is not always factual. Now we're going to go over a quick example and then exactly how the HSA pays out and what it will pay out for next. Let's go over a quick example here. So you apply for Part A in July. Part A can be backdated to January 1st, which can stop the HSA contribution by January 1st to avoid tax penalties. So that's kind of an example, like if you apply for, you can have your 6 month, you can backdate your Part A to go all the way back to 6 months. Not that you would do that. Most people are going to have Part A start when they turn 65 or in the future. But if you're past the age of 65 and you like, hey, it was a month past and you're trying to start your Part A, you can actually start it up to 6 months, back dating that. So the importance of that with the HSA is, if your Part A is going to start on your 65th birthday and you forget to do it, just keep in mind, before you're 65, 6 months prior, and you have an HSA, you need to ask the question, like, am I going to go on Medicare? And if I'm going on a Medicare, I have to stop the contributions. Some HRs, some companies will educate you on that. Sometimes I'll have somebody like me come in and educate you on that. Otherwise, you're watching a YouTube video trying to figure out, like, when do I stop contributing to the HSA, and do I have to go on Medicare Part A and Part B? Now, the HSA can pay tax-free for Part B, Part D, and Medicare Advantage premiums, copays, coinsurance, prescription coverage, dental, vision, hearing, and other qualified medical expenses for you, your spouse, your dependents, but not Medicare supplement premiums, okay? So Medigap or Medicare supplement premiums cannot be paid out of your HSA. So you just need to keep that in mind. Medicare associated Part A and Part B services and fees are Medicare Advantage, because they're contracted with the Medicare contract, private insurance companies with a Medicare contract. Those can be allocated out in your dental, vision, and hearing benefits and copays and things like that, but not the Medicare supplement premium. HRAs can reimburse plan dependent, often Part D, MA premiums, copays, coinsurance, dental and vision, Many retirees with HRAs also reimburse Medigap premiums. You need to check with your plan and whoever is advising that HRA whether or not you can pay your Medicare supplement premium out of a HRA. So HSA, no. HRA, possibly. You need to ask and be informed and ask the right questions. If you are confused about this, guys, set up a time for us to be able to walk you through this. We'll educate you on your different options. We'll tell you what to ask the HR manager so you're informed and making the right decision. So what is the one sentence you need to remember to always be able to explain or ask or say this statement to eliminate any penalties? Well, just think 6 months prior, if you're working for an employer and you don't know if you're going on Medicare Part A and Part B, or if you need to, or if you have an HSA, what are the rules? Then you're going to say, I want to eliminate the potential for any premium penalties or penalties with my HSA or Part A or Part B penalties. I need to be able to either talk to you or a licensed professional. And often they are going to tell you, we can answer these questions, but I would encourage you to talk to a licensed professional. And then you're going to ask, is there somebody that you guys work with? And if not, guess what? You're going to remember our name and number. You're going to be able to call us. We're going to walk you through. So you need to ask 6 months prior, is there anything I need to do prior to turning 65 to eliminate me being penalized on my HSA? Or do I need to enroll in my Part A and my Part B? Now, next, I'm going to walk you through the key factors of Part B, bullet points of things you need to remember if you need to go on Part B or not, if you need to go on Part A or not. These are key to eliminating penalties and so much more complications with your Medicare if you wait or don't wait when it comes to 65 years of age and older. And if you're on an employer plan, stick around, I'll be right back. So there's 2 bullet points I want to make sure you understand. One is for large employer groups of 20 employees or more, you can choose to go on Medicare Part A and Part B if you so choose without any penalties in the future, or you can enroll into Medicare Part A and or Part B if you need to, or Part D, and you're not going to be penalized because your employer group, if it has credible drug coverage, you need to verify your drug coverage, but otherwise you can have the choice to go on to Medicare or not go on to Medicare if the employer group is 20 employees or more, okay? So what happens if they drop down to 15? You need to enroll into Medicare Part A and Part B because Part A and Part B are going to be the first payer position, which goes to the second bullet point, small employer groups. We fall into this. It's less than 20 employees that work for the company. Medicare is going to be primary. You don't delay enrolling into Medicare. Very important. 20 or less, you better check it out. Basically, 20 or more, you can have options. You don't have to enroll. You can continue to stay on the employer coverage. You can enroll later on without any Part A or Part B penalties. And then your Part D coverage, always remember now with credible coverage and employer benefits plans that had drug benefits on them for years was always considered credible coverage. And now that's changed because the max out of pocket on prescription drug plans is this upcoming year, $2,100. And a lot of times the employer plan coverage exceeds that as far as coverage benefits. And so they will not be considered credible coverage anymore. If their benefit coverage is up to $2,500 or $3,000, then you may have to enroll into a prescription drug plan. So that's the caveat. The third thing is COBRA retirement plans, or COBRA, is not considered credible coverage. So if you're retiring at 65 and they say, hey, you have the option to stay on COBRA for 18 months and you enroll into COBRA, it covers you. You can pay out the nose for it, but it's not considered in Medicare's eye as credible coverage. So what happens with that? That means you're going to have a Part B premium penalty, which is a 10% premium per 12 months added up, accrued over that 18-month or 24-month period that you're on COBRA. So if you're on COBRA for 18 months, you're going to have a Part B penalty. Also, you're going to have a Part D penalty that's per month, 1% towards the national prescription plan premium average, which is usually anywhere from about 35 cents to 42 cents a month. And that accrues monthly. And then when you enroll into Medicare A and B and Part D, because you thought you had credible coverage, you're going to find out you're going to have to wait till the general enrollment period, which is the upcoming January, February, or March to actually enroll into Medicare Part B, because there's an enrollment season time frame when you miss your eligibility window. So if you're turning 65 and you're going on COBRA, beware, you're not going to be on credible coverage. You need to be educated properly, or you're going to pay for it in penalties. So Part D, this is very important. Same as the initial enrollment period, but you have 63 days of a gap rule for elimination of penalties. So if you are on an employer-based plan and you come off that employer-based plan and you're going on Medicare A and B, you have up to 63 days to enroll into Part D coverage from the credible coverage of the employer out to when your option to enroll into a Part D coverage is 63 days there, and then you have to be enrolled, or you're going to have the Part D penalty that we just talked about, the 1% towards the national Part D premium average for the year, okay? So usually it's 35 cents to 42 cents a month. They're going to add that too if you wait out 6 months, okay? Part B, you could not enroll. You could enroll into Part A, not enroll into your Part B, and guess what? Medicare gives you 8 months after credible coverage ends to enroll into Part B. B as in Bravo, and you pay your Part B premium. That premium's just gone up, and you, depending on when you're enrolling into Medicare this year in 2025, it's $185, and it's going up at the start of January. So you need to make sure that your Part D coverage is 63 days, and then your Part B you can wait to 8 months. Well, that's 8 months means you enroll into Part B, but guess what? You didn't enroll into Part D, so you'll have a Part D penalty that's going to last at least 8 months, and you're going to have to wait to guess what? The annual enrollment period of October 15th to December 7th to actually then pick up a prescription drug plan. So what does that mean? That means you need to remember the first thing I said at the very beginning of this video is that 3 months to 6 months prior to you turning 65 to talk to the licensed professional. Your HR person may mean well, but they're not licensed in Medicare. Setting up a time way before you get to the age of 65 and educating yourself on your options, how your HSA works or doesn't work. If you have an HRA, where will it pay? And then also just eliminating the potential for Part B and Part D penalties when you don't have to pay those penalties if you just make the right actionable steps. So always confirm your employer size. Don't assume you know something. Always ask questions. And then always ask the question up front, like, hey, can you help me when it comes to understanding HSAs, my Part A and Part B? Do I have to enroll? And then I'm wanting to make sure I don't have penalties, and asking the HR person. And a lot of times you'll find the HR person doesn't know. You need to ask yourself this major question as a takeaway today is, who is the licensed agent or agency or professionals that you're working with, that you're planning to work with? Because if you don't have one, I would invite you guys to be able to call, schedule a time. We'd love to be able to review your situation, walk you through how Medicare works. We'll educate you on your health plan options, see if a Medicare supplement is the best fit, a Medicare Advantage, prescription drug coverage, and making sure you don't have any lifetime penalties because you didn't take steps and actions quick enough. Guys, we'd love to be able to make your life easy by making Medicare simple. Reach out. We'll talk to you soon.